were giving an anecdote during the conference session we were just in about trying to take the automation and ICT application
Yes.
that you sell to a hospital. Tell
Yes.
us, give me that anecdote again.
We're trying to make every hospital a primary care center specialist, whereby every hospital is well equipped enough to take care of the initial care of every patient at the nick of time. Most patients die because they don't have the people to take care of them at the point of injury or at the point of entry into the hospitals. And we feel that once there is an alert system, or once there is a platform that can deliver medical alerts to NovaDOC or to a doctor on call platform, the response time is going to be shortened, whereby they're going to be able to have relevant attention given to them at the nick of time.
You've got a health app.
Yes.
Explain to me how that works.
Yes, we have a mobile app, a health app. It's called Niger Doctors on Call, NAIJA space Doctors DOCTORS space ON space CALL. It's free on Play Store, and it's a mobile app that enables people to live independently without having to say they're going to a healthcare facility which is far away from them. And then we notice that quite a number of people that live in rural facilities or rural areas have the primary care centers a lot far from them. And then quite a number of pregnant women and people that are in displaced communities have little or no access to healthcare facilities. So with the app, and with it being flexible and with it being user-friendly, all you need to do is just tap, and once you tap, it will send an alert to a server, and then it will send to a doctor on call platform, and a doctor is going to call you. You hear something like, "Thank you for calling NovaDOC Medical Service. How can I help you?" And it will send your name. It will send "I need help" without you having to type in anything. It will send in "I need help." It will send in your geotagging, meaning I know where you are. We know where you are, and we can come to you. Now, the conventional system in Nigeria is such that if you're ill, you have to go to the hospital. But right now, we wanted it to be two-way, whereby you either go to the hospital or the hospital comes to you. And we have different versions of that.
And you have a bus, don't you?
We have a bus. We have a 37-footer caravan that works well. It's in Nigeria at the moment, and we hope to replicate such by having more buses. Now, in places where the buses would not be able to go, we have rural ambulances, we have tricycle ambulances, we have very small version ambulances that would still render and deliver the same service as the bus. Only for instance, the bus is a caravan, it's a big caravan, so it's like moving a big hospital that will have facilities for other specialized care services like dental or eye. But the tricycle ambulances will be able to cater for the regular rural medical needs of everybody in the regular community in Nigeria.
So what's the business basis of the operation?
The business basis is such that people can have return on investment from subscriptions, whereby and then from the data. Every hospital should have relevant data that is tenable and that is reliable. Most hospitals right now have paper-based data, which at times are exposed to different risks, theft, fire, or even some mutilation and all sorts. But with
misfiling.
Yes, or misfiling. So that could lead to wrong diagnosis and wrong data collation. So with our app, we'll be able to generate relevant data which research institutes are looking for, which the healthcare sector needs.
How do you get from having one caravan and to being a mobile healthcare provider in a country where it's very difficult for you to register to be a provider?
Yes, it's really challenging. We had a motto. It's either it works or it works. So we just had no option than to make it work. So what we decided to do was going to the NHS system of Nigeria, which is known as NHIS. We had to go through, because most times they'll tell you, oh, you live in a place where you have to tip or you have to go through some back door to get certain things registered. We feel if we get to talk with relevant bodies, we'll be able to have policies in place that would encourage or would provide the modalities that would enable us to register freely, that would enable NGOs like us to provide the care to the needy. These people don't have money, and we don't want to do anything that's going to be expensive. We want to do a service that's going to get to people that is affordable and is also accessible.
But
so
currently your problem, there is no licensing category.
Apart from no licensing cash, we are also having to depend on funding. If we're going to give something to someone free, or even if we're saying we're going to do free medical service, the real thing is it is getting to the recipients free of charge. Somebody else pays, a donor pays, a grant pays. So that is what we really would need if we can have certain legislature give us an opportunity to make certain write-ups, and it being upheld such that it will translate into governing bodies influencing each local government to provide at least one mobile or rural van or ambulance in that community, and having us run it, because we can run it actually remotely. I can run every typical van from my room or from my office, because all you see on the voice over internet protocol systems are different screens, all representing different locations in the country. So if we're allowed to replicate such technology in Nigeria, I think Africa will be a better place to live in.
And have had much resistance from traditional healthcare providers to what you're proposing?
Because of the culture and diversity of Nigeria, we've been having a lot of people resisting. They at times when we pop in there, they see us at times as intruders. What are you coming to do? What do you want? So we've had to.
That it will put them out of a job.
Yes. So we've had to incorporate them into the service, whereby we've been training. For instance, now 2 to 3 weeks ago, we were in Kachia local government in Kaduna State, where we trained 100 community healthcare workers. These are the doctors on call in every community, and then we also trained the traditional birth attendants, who are the first on call to take deliveries of the women in the communities. So we brought them in. We trained them on rudiments of first aid. We trained them on basic life support. We trained them on AEDs. Apparently, there are very few AEDs or defibrillators in Nigeria, and in fact there are few first aid kits in vehicles on the road. There are a few people that know how to even use a first aid kit. So we try as much as possible to train people on first aid or initial care, so that they know what to do when emergencies strike.